Native TV presents Maternity Voices.
We've had the challenges with our maternal respective rights of these women with disabilities while going for health services in our different health facilities in the district. The most notable ones, issues of communication between the expectant mothers who go to these facilities to seek for those services. They have got challenges that these ladies or these expectant women with disabilities hardly communicate with the health workers during antenatal and during delivery. This, I think, in most cases even results into unnecessary cesarean birth because they cannot communicate with people who cannot speak, whom we normally call the deaf. But for us, we call them persons with hearing impairment. Also, persons with visual impairment. You know, those practices and examples that the midwives give towards expectant mothers. Whenever these people approach them, they hardly communicate with them. We also have issue of negativity or stereotypes, social stereotypes amongst the health workers to these people, and this one increases stigmatization. When the expecting mothers with the disabilities approach health workers, some of them can arrogantly ask them, if you cannot climb onto this bed, then how did you conceive? This one stigmatizes them more and even keeps them away from going to deliver from the hospitals. And this increases number of the death of their children. I also have challenge with the delivery beds or the operating beds. We have one district hospital. We have one sub-district hospital. But in both of these facilities lack a delivery bed for persons with disabilities. This one becomes a challenge to them while they are going for delivery. Some of our expectant mothers, when they conceive, some of the husbands run off from them. They hardly accept that they are the wives. So they end up going to these facilities themselves or don't go. And this one becomes a challenge to these mothers of ours. We have other issues of stigma. Stigma is also affecting our expectant mothers. Stigma has led into these expectant mothers to accept the status they are in. And in so doing, they fail to open up. And once this is done, they end up also having children with the different abilities. And this one now becomes a challenge to the district. Because as per the present directive, whereby we should look at preventive measures to reduce on the number or to contain the number of the persons with disabilities in the district and the country at large. But because of the above challenges listed, we are increasing the number of these children with disability, the number of the people with the different abilities in the country. Distance is also another problem, coupled with lack of mobility assistive devices. Women with disabilities lack wheelchairs, lack CALPAs, and more so lack transport because they stay far away from the health facilities. So once they are pregnant, commuting on a monthly basis to go for antenatal services becomes a challenge. Getting someone to carry them on the motorcycle is hard. And at times some of these boarders take advantages of these expectant mothers because they know you already a person with different abilities. You may hardly have an option of bargaining for a cheaper transport means because you cannot walk a longer distance. So you end up being cheated highly because you have no option. When you come to persons with different abilities who are visually impaired, they cannot go to the health facilities alone. They are supposed to walk there with a person guiding them. So this one increases on their cost of moving to these antenatal services.
Maternity Voices is brought to you by Native Voices International in collaboration with White Ribbon Alliance Uganda, thanks to support from USAID through East-West Management. No woman should lose a life while bringing a life to this world. In Uganda, the high maternal mortality of 326 by 100,000 deaths is preventable if all necessary precaution is taken by, among other interventions, ensuring that all mothers make all the required 8 antenatal visits, have health facility-based delivery, are delivered by qualified and skilled health providers. Mothers are treated with dignity and respect, have access to health facilities are well equipped, hygienic with the necessary medical supplies, health providers are respected, and mother's consent is given before a procedure. For this to happen, we all have a role to play by exercising respectful maternity care, demanding for it, and creating awareness about it. Join us as a partner in the campaign to establish a respectful maternity care. You can start by liking this video, sharing it in your networks, and subscribing to the Native TV YouTube channel for updates on this campaign and other common good